Getting it right for people with learning difficulties.
What we've come to talk to you about today is how you get on with using your GP surgery.
South Gloucestershire Link Local Involvement Network is an organisation which gives people a say in how the local health and social care services are run. In 2010, the People with Learning Difficulties Working Group within South Gloucestershire Link reported that many people experience problems when visiting their GP. I'm Kate. Sarah and I were asked to do some research and make recommendations about how GP services could be improved for people with learning difficulties. We designed an accessible survey and sent it to people with learning difficulties through Milestones Trust, and we met and interviewed people with learning difficulties. We talked to some people in their homes and to other people at the Hive drop-in centre and to a group of people with learning difficulties at Stepping Stones in Warmley. Would you be able to go to the doctors on your own?
Yeah.
We asked people questions about their GP and their health centres. Most people, 93% of the people in our survey, said they were mostly happy with the support they received at their doctors.
Yes. And do you get time to ask them questions as well?
I do, yeah.
Arriving at the surgery and checking in, we wanted to find out how people made an appointment and how they preferred to check in and how they knew when it was their turn to see the doctor. Most health centres now have touchscreens to check in. Do you sign yourself, or does the person who comes with you sign them for you?
How does Dad do it? Dad?
How do you get on using one of those, the touchscreen? Andrew?
Sometimes I find that difficult.
Which do you prefer? Or going and saying hello?
Yeah, I think Alice is more hello, but she's
The hello.
I find the touchscreen very, very inaccessible, and I find just when I go to reception and say I'm here, particularly if I'm on my own. Some people we talked to did use the touchscreens, but 80% of the people said they found the touchscreens inaccessible. We recommend that GPs offer everyone the option to check in at reception if they need to or choose to. We asked people how they knew when it was their turn to see the doctor.
Screen.
Yeah.
So does your name come up on it? And does it tell you what room to go to? And is that okay? Are you able to keep an eye on that and know when it's your turn?
Yeah.
What do
Screening
other
eyes.
people think? Do you think it's better if the doctor or nurse comes out and asks you by name?
Yeah.
80% of people said they didn't know when it was their turn to see the doctor. We recommend that all GPs and health staff go to the waiting room to collect people with learning difficulties when it's time for their appointment. Does your doctor listen to you? Does the doctor take time to explain things to you?
Yeah.
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 Does he listen to you and then give you something to make you better? Yeah.
GPs are there to listen to us, aren't they?
Yeah, they are. I think some people find it difficult to go to the doctor because they're not listening to them.
Yeah. Did they talk to you first or to your support first?
Report first,
They
and
talked to support
then me after.
Okay.
And you would for them to talk to you
Yeah,
when you go in. And do they rush you while you're in there?
yeah.
Okay. So more time sounds like would be
More
a good
time.
idea as well.
I don't like interruptions because it makes me lose my train of thought. It gets me confused. And if I'm trying to say something personal, I just feel it's difficult then to put things across to the doctor.
And do you think other people with learning
Yes.
difficulties feel like that?
Yes. I think they more do when there are not people there to support them.
I think they need a lot more training than they got now.
Yeah.
It's getting there, right? But they need a bit more training.
Yeah. And they need to be trained on what our needs are.
Yeah.
Does your doctor listen to you? 93% of the people said yes. Some people did feel rushed and didn't like interruptions during their appointments. 20% of people said the doctor and other staff talked to their personal assistant or supporter before talking to them. We recommend that doctors and all staff talk to the person with learning difficulties before speaking to the personal assistant or supporter, and that GPs ensure that appointments are not rushed and not interrupted by calls or other staff. We recommend that GPs work with people with learning difficulties in accessible ways and use formats such as Easy Read whenever appropriate. Practice nurse.
I think some people might be scared to go to the doctor.
Might be scared to go.
Yeah.
Why do you think they might be scared?
So, I think some of them, when they're overweight, when their blood pressure's too high, you know, they need somebody to support them.
Hi, good morning. How can I help?
At my GP's practice, there's a nurse who supports people with learning difficulties. Paula can help people make appointments and will talk through any worries. Paula can go in to see the doctor with you if you would like that. And Paula also does annual health checks for people with learning difficulties.
What difference do you think it makes having me around when you do want to see the GP?
It means you'll help me voice my feelings across to the GP. But I find most of the GPs know me in the surgery now, so
They do, but if you perhaps saw a locum doctor that you didn't know very well.
I would ask if you could come in and support me and
Yeah.
help me talk through the problems with the locum.
Yeah. Really, what I do is just tailor it to that particular person. So I know what you like. I know if you like a phone call or you prefer me to send a letter, or if I see your name, I run down and see you in the waiting room. So I just do it to that individual, really.
That's really good. Really calming and special. And very, very reassuring. Yeah, I would recommend that the GPs go down the road of having somebody like Paula. I mean, then people can have somebody to talk to. We recommend that GPs provide training for all staff to meet the needs of people with learning difficulties and consider developing the role of a specialist practice nurse to support people with learning difficulties. Annual health checks and health action plans. All doctors should offer all people with learning difficulties in their practice an annual health check and draw up a health action plan.
So do you think you've had that check? Do you think you've been having that check every year? You do?
Yes, they've done it before.
They have?
They've done it to me.
Yeah?
Do you have a health action plan?
No.
No. You would like to have something like that?
Yeah.
But you've never had anyone go through like a plan about your
No.
health, or
No.
it might not look exactly the same as that.
Do you actually keep a copy at your house of your health action plan, or is it kept at the doctor's?
Doctor keeps it, yeah.
Doctor keeps it. Most people we talked to, 86% had an annual health check. Everyone thought it was a good idea to have an accessible copy of their health action plan so they could share the information with their family and personal assistants. Most people we spoke to did not have a copy of their health action plan. We recommend that all GPs offer all people with learning difficulties an annual health check and provide them with an accessible copy of their health action plan. Sharing our results. After we had a look at the responses to our survey, we held an event to talk about what we had found out. We invited people with learning difficulties, doctors and people working in health services. We ran discussion groups and asked everyone for their comments. We asked people from the health services what they had found out from our work.
At the present time, we don't have a touch screen system at the front desk, but we're considering getting one of these. I was interested to hear that the majority of patients with learning disability are not able to use the screens, and that they find it particularly important that they can therefore access the receptionist, and we would certainly take this into consideration and make sure that we maintain the reception service that we currently have.
Education of the staff is key. It's been really useful for me today, both as a practice manager but also as a board member, because I think there's things that we can do without spending lots of money.
I was really very pleased to hear how positive the feedback was. I think there was clearly an issue around touch screens for some. I think the other thing is around the health action plan. The principle behind the annual health check is that a health action plan is completed and the copy in an easy-to-read format is given to the patient, and if they aren't being used routinely, then I think we need to recommend that practices seek to try and do this more often. And I think the other one was around having a nurse with a particular interest in learning difficulties within a practice. So I think there are lots of good things. I think that hopefully there'll be some quite strong recommendations that we can then share with practices across South Gloucestershire and build on what I hope is already really quite high quality services that we can then improve on and make even better.
We hope that our research and recommendations will help GPs and their staff improve services for people with learning difficulties and for everyone.